Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So today we'll discuss about pathology coding and the salary for pathology coders, and also we'll see the scope and growth about the pathology specialty. And later in the PPT presentation I have added most common interview questions for pathology coding. Please do watch video till end, and again if you find it informative and useful for your career growth, please do subscribe to my channel and please do share with your medical coding friends. Before getting into interview questions, we will discuss few general questions. So the first question is, do we have any specialty coding certification for pathology coding from AAPC or AHIMA? Okay, my answer would be no. We don't have any such pathology coding specialty certification. Okay, so if we have a CPC certification or any other certification, that would be fine to be a pathology coder. So next question is, what would be the salary for pathology coders? So if you are an entry level pathology coder, then you will be expecting around 2.8 lakhs to 3.5 lakh per annum. And if you have more than 2 year experience, then you can expect around 6.5 to 8 lakh per annum. Okay, so the salary is purely based on your experience and your skills and the certifications. And later, coming to job opportunities, so in pathology coding, so when you compare between organization job opportunities and hospital job opportunities, you will have more pathology job opportunities in hospital, not in organization. So in organization, this pathology coding specialty will be very limited. Okay, so you have to choose, you have to research, and then you have to get a proper place. So now we'll discuss few basic interview questions. So assume you are CPC certified but you are a fresher, and now you are attending an interview for pathology coding specialty. So what are the questions they might ask you? So first, be thorough with all the ICD chapter specific coding guidelines. Okay, chapter wise coding guidelines. And focus on chapter 2, which is neoplasm. So make sure that you are aware about how to code neoplasms, like how to lead benign condition, malignant condition, everything. And apart from ICD coding guideline, you should know few medical terminologies like what is biopsy, what is FNA, okay, and what is pap smear. And again, if you have studied any kind of staining like gram staining and the other stains, and also special stains, okay, and conditions like what is benign, what is malignant, carcinoma. Okay, carcinoma is nothing but it will lead to malignant. And again, what is metastatic, what is in situ. Okay, so these are the very basic questions for the pathology interview. Okay, and now we'll see, I have added 25 questions which are most asked question. So I have explained all the questions answers as well. Please, as I said, watch video till the end and understand everything. Okay, so yes, let's get in. So let's discuss the interview questions. So here I have added all the important concepts from the pathology section. And what you are seeing, the biopsy, FNA, most micrographic surgery, these three topics belongs to integumentary section, but it is directly related to pathology section as well. Okay, so you should know the guideline for biopsy, FNA, core needle biopsy. Like in the fine needle aspiration, they will be using very thin needle, whereas in the core needle, they will be using larger needle. Okay, then most micrographic surgery, again here the CPT code range between 17311 to 17315, where this 17315 will be universal code. Okay, this we will be using for blocks, and 17311 to 17314 we will be using for stage coding. Okay, so we will check how many stages they have performed and each stages how many blocks they have removed. Okay, so based on that we will be coding that. Next, pathology consultation during surgery. Here the pathologist should be there during the surgery, to give his opinion or to give the interpretation. Okay, during the surgery. So consultation is nothing but they should have that request, report, and rendering the service. Next, cytopathology. So in the cytopathology, CPT code range between 88104 to 88199. So here in cytopathology, we will be having two types. Okay, one is gynecological cytopathology and one more is non-gynecologic cytology. Okay, cytopathology. Next, cytogenetics. So cytogenetics is nothing but here they'll be dealing with analyzing the chromosomes and again like it's a genetic disorder. So we will see the techniques and according to that we will be assigning codes from cytogenetics. Next, molecular pathology. So here in molecular pathology it will be like it includes DNA, RNA based test and with codes based on test complexity and genetic panel we will be assigning the codes from molecular pathology. Next, surgical pathology. Here in surgical pathology we will have the different levels, different, like you can see 88300 to 88 sorry, surgical pathology 88300 to 88309. So here in the surgical pathology, as I said, will have the different levels. So we have to check the specimen belongs to which level, and according to that we can select the level. Okay, so like codes vary based on the complexity and type of specimen. Okay, if they are doing resection or if they are doing biopsy, so everything we have to check. And also in surgical pathology, 88300 will be only gross examination. Gross examination means visualizing the initial, visualizing and taking initial opinion. Okay, they will be not using microscope. Whereas gross plus microscopic means both. They'll visualize also and they'll use microscopic also. Okay, so in this surgical pathology, when we are evaluating the levels, we should check the specimen is available in any other level also. Okay, because with the small differences, we may have the two different levels. So if skin maybe if you can find in a level 2 also, like 88302, and you can find skin in 88304 also. Okay, there will be two differences. One is skin for plastic repair and skin other than skin tags. Likewise, there will be some differences. So we have to pay attention to that and we have to get it right. Next, anatomic pathology. In this anatomic pathology, we will be seeing like postmortem and CNF. Okay, forensic. So everything will be listed in the anatomic pathology. Again, clinical pathology includes penals, chromosome abnormality, fish. So most of the time they'll ask this, what is the full form of fish, and molecular diagnostic genomic sequencing. So whatever I have listed here, these are the important concept under pathology. So as you all know, in pathology, few clients will be working only for ICD, whereas few clients will ask for both ICD and CPT. Okay, so these are the CPT portion which are very important, and when it comes to ICD, as I said, neoplasm will the take proceedings. Okay, so let's begin with the questions. So our first question, what is special stain and why it is used in pathology? So special stains are used to highlight the specific tissue or cellular components that may not be visible with the routine stains. So whenever they are doing sliding, if the cellular component or specific tissue, if they are unable to see by routine stain, they'll be using special stains. Okay, so like AFB and again PAS, all of the stains. You should know the examples also for special stains. Next, what is the primary purpose of pap smear in cytology? So pap smears are used in gynecologic cytology to detect the precancerous or cancerous changes, okay, in cervical cells. So what does the term FISH stands in molecular pathology? So FISH stands for fluorescent in situ hybridization. Okay, so why do they use that? So FISH is a molecular technique that uses fluorescent probes to detect the specific DNA sequence on chromosomes. So often used for identifying genetic abnormalities. Okay, so FISH stands for is important. Please remember fluorescent in situ hybridization. Next, why is gram stain is important in pathology? So gram staining helps to classify the bacteria based on their cell wall structure. Okay, so they could easily make out what kind of bacteria it is. So since they see the cell wall structure with the gram staining. Next, in which field is immunohistochemistry, that is IHC staining is primarily used. So IHC uses antibodies to detect the specific antigens in tissues. So mainly IHC stain is used to identify the tumor markers. Okay, so IHC stands for immunohistochemistry. This is also one kind of stain. And then what is the purpose of intraoperative frozen section examination? So the frozen section is used for quick examination of tissue sample during the surgery, allowing the surgeon to make immediate decisions. So whenever they are performing, say for example, pathology during intraoperative consultation. Okay, pathology consultation during intraoperative surgery. That means if the pathologist is available, if he is doing frozen section at the time of surgery, so that he can interpret what is the result. Okay, so based on the result the physician can take the immediate decision. So frozen section is nothing but it's a quick examination. Example for special stain. So past stain, PAS is a special stain used to identify glycogen and other polysaccharides in the tissues, helping in the diagnosis of various disease. Okay, so as I told you all earlier, special stains we will be using to highlight the cellular components when we couldn't find the same cellular component with the routine staining. Okay, then they'll be using the special stains. So here examples include not only PAS, the PAS stands for periodic acid skiff, and we do have AFS, that means acid fast stain, and again we do have GMS stain, and again there are many special stains, Congo red, oil red. Okay, there are many special stains we have. Please do check on that. Next, eighth question, what does MIPS stands for in healthcare quality and reporting? Okay, MIPS stands for Merit Based Incentive Payment System. Okay, and it's a CMS program that adjusts the Medicare payment based on quality, cost, and improvement activities in healthcare practices. Okay, we will be having MIPS codes also for the particular conditions. That is again for the most experienced coders. So you just have to be aware about MIPS abbreviation or acronym. Next, what is the primary goal of cytopathology? Cytopathology focuses on examining the cells and often from bodily fluids like scrapings to identify diseases such as cancers and infections. So as the name says, cytopathology will deals with the cells. Okay. So next, why are the immunohistochemical stains are important in cancer diagnosis? Okay, IHC stains help in identifying the tumor markers which assist in determining the cancer type and possible treatment options. That is why they will be utilizing IHC stain. What does cytogenetics study? Cytogenetics focus on analyzing the chromosome to detect the genetic disorder and often through karyotyping or FISH. Okay. So next, which is the main use of the tissue decalcification in pathology? So decalcification removes the calcium from the tissue such as bone and making it easier to slice for the microscopic examination. Okay, so the bone portion or the calcium portion, it will be like dissolving with the decalcification method, and then it will be easier to do the microscopic examination. So next, In which type of pathology is a core needle biopsy typically used? So core needle, as I said, in core needle biopsy, they will be using larger needle. So core needle biopsies collect the tissue sample for histological examination, often used for breast or prostate evaluation. So to evaluate breast cancer or prostate cancer, they will be utilizing core needle biopsies. So next, what type of specimen is commonly examined in non-gynecological cytopathology? Okay, non-gynecological cytopathology examines cells from various bodily fluids, detects the infection, cancers and other diseases. Okay, so here the other thing you should know is what is gynecological and what is non-gynecological. Okay, gynecological it deals with the pap smear. Okay, they'll be dealing with the reproductive system, whereas non-gynecologic it deals with the cells. Okay, so next, what does the role of genomic sequencing in pathology? So genomic sequencing helps in identify genetic mutation, okay, and associated with the disease, aiding with the diagnosis and personalized medicine. So next we will be having 16th question. What is the primary purpose of surgical pathology report? Surgical pathology involves examining the tissue removed during the surgery to provide the diagnosis and to guide treatment. Okay, as I said, surgical pathology involves various levels based on the severity and based on the procedure, like biopsy or excision, resection. Likewise, we should check the specimen belongs to which particular level, and based on that we will be taking one surgical pathology level. Okay, like 88305, 88307, likewise. Next, 17th, which staining technique is used to identify acid fast bacteria? Okay, AFB staining. AFB stands for acid fast bacteria. Okay, this stain they'll be using to detect bacteria like Mycobacterium tuberculosis in tissue samples. Next, 18th, why are frozen sections often used during surgical procedures? Okay, so as we previously discussed, frozen sections are quick examinations, so that they'll be utilizing frozen sections during the surgery to take the immediate decisions. Next, 19th, what is the primary purpose of cytology? Cytology focus on cytology studying cells, diagnosis, often through sample like fluid or tissue scrapings. And what is the difference between gynecological and non-gynecological cytopathology? So, gynecological cytopathology focuses on specimen collected from female reproductive system, while non-gynecologic cytopathology involves sample from other body sites, diagnose wide range of conditions. Next, what is surgical pathology? Surgical pathology is a branch of pathology that involves the examination of tissues removed during the surgical procedure to diagnose the disease, and it provides the crucial insights to the nature of extent of disease. Okay, and we know it will guide the treatment as well. Next, how are the levels classified in surgical pathology? Okay, first, gross examination. Gross means it's initial visual inspection. That means without using microscope, just through naked eyes. Microscopic examination, it means using microscopic evaluation. Okay. Next, special studies includes techniques like special stain, immunochemistry. Okay, and that is called special studies. Next, in surgical pathology, what does margin refers to? So margin is an edges, the specimen that are examined for cancer involvement. Okay, if they are performing excision of lesion and if they are giving 2 centimeter the right side margin, 2 centimeter left side margin, we will be combining the margins and we will be adding with the lesion diameter to take the overall lesion diameter. Okay, so margins are nothing but it's just an ends for cancer involvement. What does modifier 26 indicates in pathology billing? Okay, so 26, the description of modifier 26 is a professional component. It is not only for pathology billing, it's for all. Okay, so whenever we do have a professional component, we will be assigning 26 modifier with a particular CPT. Next, in what scenario modifier 91 is used? So whenever we have a medical necessity and physician is ordering repeat laboratory testing, same test they are ordering twice, that time we will be using 91 modifier. Okay, so these are the 25 questions. As I said, apart from these questions, please go through neoplasm chapter wise coding guideline, and please be good at finding ICD for neoplasm like benign conditions, malignant conditions, and then the few medical terminologies, excision, destruction, shave removal procedure, wherever pathology opinion is needed, all those procedures are important. Okay, so in the first slide I have listed all of the important concept. Do not ignore those. If you are going for any pathology interviews, whether you are a certified fresher or maybe you might have the experience, these are the things that you should be aware of. Okay, so that's all guys. Thank you for watching, and if you find it useful, please do comment and please do share with your friends, subscribe to my channel and support me. Thank you all, and if I'll plan to come up with any other specialty interview questions also. Thank you all.